Health Minister Dr. Joe Phaahla has announced that several provinces are already in the fifth wave of the coronavirus pandemic. This was motivated by a technical definition proposed by Epidemiology Professor Salim Abdool Karim. Dr. Phaahla was speaking during an update on COVID-19 in the country and efforts to combat the outbreak.
The question which is now on top of our minds is whether we have entered the fifth wave. Much earlier than we expected, because all along we've been expecting, as advised from our scientists, that probably middle of May or later in May or even early in June we may enter the fifth wave. The question now on the top of our minds is whether, and as it's been debated in a number of media platforms, is whether indeed this fifth wave has commenced. Just amongst those who have been commenting on this, it's Professor Salim Abdool Karim, the previous chair of the Ministerial Advisory Committee, who issues a weekly email report in terms of his observation. And in this week, Tuesday, in his analysis, he argues that from a technical definition of more than 5 cases on a daily basis per 100,000 of population, with that as a criteria, he believes that we have entered the fifth wave, that in most of the provinces we have entered the fifth wave.
Let's expand on this. We're joined by Malan, Editor-in-Chief at Bhekisisa Centre for Health Journalism. A happy Friday to you, and thank you very much, Mia, for always availing yourself. It would appear by all indications, as we just heard from the Health Minister, that the fifth wave is nigh. What would make this one different from the other waves that we have experienced?
So just to expand on what the Minister said there, what Professor Abdool Karim said in his weekly email is that, yes, if you look at calculations, then we have enough cases to say that we have entered a new wave. But what we don't yet know for certain, and that we will only know around about mid-next week, is if these cases will be sustained, so whether they will increase for long enough to form an actual wave. So if you look at earlier this year in January, when we were on the decline of the Omicron wave. During that time, we also saw an uptick in cases that was caused by a new form of the Omicron variant, but that was not sustained. It was roundabout when schools opened and cases then went down again. So what Professor Abdool Karim is saying is that we need to wait till mid-next week to see if these cases continue to increase. And if they do, he says we will see around about 10,000 new cases each day from mid-next week. Now, what will be different if this turns out to be a sustained wave? What will be different about this fifth wave is that it won't be driven by entirely new variants. It will be driven by just slightly different forms of the Omicron variant, which was the variant that drove our fourth wave. If we look at the other waves that we've had, all of them have been driven by a new variant, so a variant that's not related to the previous one. But in this case, we have 2 new forms of Omicron known as BA4 and BA5, and they are responsible for causing this uptick in cases. What we now need to see is if this uptick will be sustained. We don't have very clear data, but we have indicators that show us that these 2 variants could be more transmissible and that they could escape immunity to some extent. In other words, could escape the immunity of the original form of Omicron, and that we haven't really seen before.
And that's just it. If we see an uptick in the number of infections, would that mean that we'll see an uptick of vaccinations? With every wave, we have been encouraged to vaccinate, and now for people to get booster shots, that part of the population at least that has been vaccinated.
It's hard for me to say that, but we can only look at what has happened in the past, and each time that we entered a wave, so that we heard about more infections, people were more likely to take up vaccinations. When I say each time, really only in the previous wave, because we didn't have vaccinations at the beginning of the Delta wave, the third wave, and none in the previous waves. So the fear of infection generally does look to have a bit of an effect on whether people take up vaccinations or not. But if we look at our general state of vaccinations, it's really, really going slowly. If we look at yesterday's numbers, there were 62,000 doses that we administered. Our aim last year was 200,000 doses a day. And the big concern is if we look at who is coming for vaccinations. So of those 62,000 doses, only about a third of those doses were new people coming for vaccinations. The rest was all people coming for boosters or coming for their second doses. And those two-thirds of people coming for that will eventually run out because there's a cap on how many doses you get. So what we need to concentrate on now is to get new people to come for vaccinations. The only upside that we're seeing here at the moment is that during the course of May, we're likely to reach the point where we have vaccinated half, 50% of all adults. And then from then onwards, we'll look at a scenario where more adults have been vaccinated than not vaccinated. And that's not something that we've been able to say up until now.
Mia, the High Court will rule next week if South Africa's health regulations can stand. And of course, public comments on that has closed. When is that likely to be finalized, and what do you see being the way forward here?
So what we have at the moment is we have interim state of disaster regulations that will expire by the 5th of May. So by then, we need to have new regulations in place. Now, the big question is, what will those regulations look like? We know regulations were gazetted, but now it's been open for public comment, and the Health Department said this morning that they've received almost 300,000 submissions for these regulations. And there's now a team of 90 people, I understand, in the Health Department who are going through these regulations, and they need to see which ones will be adopted or not. I think one of the regulations that people have been complaining about most regularly has to do with the regulations that determine what you need to do to enter South Africa with regards to COVID. So you need to present a PCR test. If you were not vaccinated, you need a negative one. And if you were vaccinated, you can just enter. But part of that regulation says that children who are younger than 12 also need to be vaccinated or have a negative PCR test. And in South Africa, there are no vaccinations available for children who are younger than 12. So if you travel with your children from outside of South Africa, you can just take them and go, depending on the regulations of the country where you're going to. But when you return, you need to get them PCR tests because there was no way that they were going to get vaccinated in South Africa. And people argue that that part really needs to change because you can't have a regulation that requires someone to be vaccinated if you're not offering vaccinations for them.
Mia Malan, Editor-in-Chief at Bhekisisa Centre for Health Journalism. Thank you for your time this afternoon.